and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12.
Hello, Doctor. Good morning.
Yes, good morning. What's your problem?
Well, Doctor, I have a sinus problem. I get post-nasal drainage, facial pain, headaches, sore throat and congestion.
Since how many days have you been facing this problem?
For the past 2 weeks, Doctor. I'm also getting snoring, teeth pain and nasal burning.
Is it moderate or severe?
It worsens in the evening and morning.
What's your age?
47, Doctor.
Did you have any illness previously or any surgeries?
Yes, surgeries, gallbladder and hernia.
Do you drink, smoke?
I don't drink, but I smoke 1 pack of cigarettes per day for the past 15 years.
Any of your family members have any illness?
Yes, I have a family history of allergies and hypertension.
What are the medications you are taking?
Claritin, Dilantin and Rhinocort nasal spray.
Are you allergic to any medicine?
No, Doctor.
Well, your auricle's external auditory canals reveal no significant abnormalities bilaterally. TM's intact with no middle ear effusion and are mobile to insufflation. Your intranasal exam reveals moderate congestion and purulent mucus. Your oropharynx examination shows teeth. Alveolar ridges reveal missing molar. Examination of the posterior pharynx show a prominent uvulva and prominent postnasal drainage. The palatine tonsils are 2+ and cryptic. The palpation of anterior neck reveals no tenderness. Examination of the posterior neck shows mild tenderness to palpation of the suboccipital muscles. Facial examination shows there is bilateral maxillary sinus tenderness to palpation. Waters View X-ray reveals bilateral maxillary mucosal thickening. You have acute maxillary sinusitis, 461.0. Snoring, 786.09. Well, I am prescribing you Augmentin, 875 milligrams twice a day, and Mucofen, 800 milligrams twice a day. Follow these medications for 3 weeks and meet me after that. If the conditions don't improve, then I will order a mini sinus CT.
Extract 2. Questions 13 to 24.
Hello, doctor. Good morning.
Good morning. May I know your problem?
Well, I'm having asthma and facing difficulty in walking even 10 steps. My weight is 344 pounds. I have high cholesterol and high blood pressure. I have joint pain, back pain, foot and ankle pain, and swelling on my leg and foot. I have sleep apnea and snoring. Moreover, I am a diabetic patient on medication. I also have hemorrhoids, doctor. I am also pursuing surgical attempts for weight loss and to become active in my life again.
What's your age?
37, doctor.
Okay, do you drink or smoke?
I do smoke, and I have stopped drinking alcohol a year back.
Have you undergone any surgeries earlier?
I underwent orthopedic knee surgery, doctor.
Can you brief me about your family history of diseases?
All my family members have obesity, heart disease, and diabetes, and negative for hypertension and stroke. But I am using Chantix to come off smoking completely.
Okay, tell me about your food habits.
I eat things like bacon, eggs, and cheese, cheeseburgers, fast food.
How many times do you eat in a day?
I eat 4 times a day, 7 in the morning, at noon, 9 p.m., and 2 a.m.
Well, the ideal weight for your age is 184 pounds, and you are weighing 344 pounds. That means 184 pounds in excess. What medications are you taking?
Diovan, Crestor, and Tricor.
Do you have any chest pains or any mild attacks?
No, doctor.
Well, your cranial nerves 2 through 12 are intact. Neck is soft and supple. You have positive wheezing bilaterally. Heart rhythm is normal. Abdomen is soft. You have 1+ pitting edema. I have reviewed your complete test reports. This is a clear case of bariatrics, and you need to go for a laparoscopic Roux-en-Y gastric bypass. The complications include infection, bleeding, pulmonary embolism, deep venous thrombosis, leakage from the gastrojejunal, anastomosis, and possible bowel obstruction. Before we proceed for the surgery, you need to get reports on upper endoscopy, H. pylori testing, thyroid function tests, LFTs, glycosylated hemoglobin, and fasting blood sugar.
Okay, doctor. I would like to proceed with the surgery.
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25.
Hello, doctor. What are the clinical manifestations of alpha-1 antitrypsin deficiency?
Well, alpha-1 antitrypsin deficiency is associated with 2 major clinical manifestations. Emphysema, resulting from the loss of the proteolytic protection of the lung by alpha-1 antitrypsin, a toxic loss of function. Other clinical manifestations of alpha-1 antitrypsin deficiency include panniculitis and an association with cytoplasmic antineutrophil, cytoplasmic antibody-positive vasculitis.
Question 26.
Hello, doctor. What are the different types of lung cancer?
Squamous cell carcinoma, or epidermic carcinoma, usually starts in the bronchial tubes in the center of the lungs and can cause symptoms early on, especially hematypus. Large cell carcinoma often occurs in the outer regions of the lungs and tends to grow rapidly. Mesothelioma actually begins in the mesothelium, a membrane that surrounds the lungs. Small cell lung cancer usually grows in the central areas of the lungs, and most people have few symptoms until just before they are diagnosed. Lung carcinoid tumors are made up of cells called neuroendocrine cells. Question 27.
Doctor, can visual function be improved through occupational therapy?
Well, findings proved that occupational therapy for patients with poor vision performed at their home and directed particularly toward helping them with both meaningful and challenging tasks, helped avoiding depression that actually improved the visual function as well. It was observed that those with milder visual impairment actually performed much better on these questionnaires after the occupational therapy group, whereas those who were in the supportive therapy attention control group could not improve their visual function measures. Therefore, the occupational therapy role not only improved in some of these depressive symptoms, but also in this specific subset of patients with mild impairment did improve their visual function as well. The comprehensive approach to rehabilitation, including in-home occupational therapy for those with visual impairment, is the key to improving visual function.
Question 28.
Doctor, how do we get rid of the imitators of Stop the Bleed kits?
Stop the Bleed is a national campaign to increase awareness and provide training and kits to help the people witnessing traumatic bleeding. However, we must be very careful when obtaining the kit for our locality. The genuine kits are really very expensive, that may cost from $50 to $100 depending on the contents. However, there are some counterfeit tourniquets which are knockoff products. I would warn everyone that a tourniquet is meant for controlling acute arterial hemorrhage, will cost about $25 to $35. Therefore, if you're getting them for a lesser amount, you probably won't get the best one.
Question 29.
Doctor, what is epilepsy and what is a seizure? Epilepsy is a neurological or brain disorder which is also called a seizure disorder at times. Often, the patient is diagnosed with epilepsy only when they have already had 2 or more seizures. A short change in normal brain activity is called a seizure, which is the main sign of epilepsy. While certain seizures appear like starting spells, other seizures cause the patient to fall, shake, and become unaware of what's happening around them. Generally, a seizure lasts up to a few minutes depending on the type of seizure. Generalized seizures affect both sides of the brain, and focal seizures or partial seizures affect one side of the brain.
Question 30.
Hello, doctor. What is your opinion about misdiagnosing of acute cardiorenal syndrome as renal injury due to hypovolemia?
Often, acute cardiorenal syndrome is misdiagnosed for renal injury due to hypovolemia. Patients with stable heart failure normally have mild hypervolemia at baseline. However, they can become hypovolemic due to severe diarrhea, over-aggressive diuretic therapy, or other causes. Although the fluid status of these two conditions are different, they are often difficult to distinguish. Urine electrolytes suggest a pre-renal acute kidney injury in both of these conditions. However, a history of recent diuretic overuse or recent fluid losses may help identify hypovolemia. If available, analyzing of the recent trend in weight will be essential in making the right diagnosis. Misdiagnosis of acute cardiorenal syndrome as hypovolemia-induced acute kidney injury will be catastrophic. In case the volume depletion in acute cardiorenal syndrome is erroneously judged to be the cause of acute renal injury. Therefore, fluid administration can further worsen both renal and cardiac function.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36.
Hello everybody. I am going to explain to you different types of hemolytic anemia. Hemolysis is the breakdown of red blood cells that typically has a lifespan of 120 days. After this duration, they die and break down. One of the main functions of red blood cells is to carry oxygen to every part of our body. Therefore, in case the red blood cells break down abnormally, there will be very few of them to carry oxygen to our body parts. Certain diseases and conditions cause red blood cells to break down too early, resulting in fatigue and other more severe symptoms. There are different types of hemolytic anemia, and the conditions can be either inherited or acquired. Let me explain to you certain disorders and conditions of different types of hemolytic anemias. Inherited hemolytic anemias usually occur due to a faulty gene that controls red blood cell production. While moving through the bloodstream, abnormal red blood cells may be fragile and break down. Sickle cell anemia is a severe inherited disease where the body produces abnormal hemoglobin, causing the red blood cells to have a crescent or sickle shape. Sickle cells usually die within 10 to 20 days, as the bone marrow can't produce new red blood cells fast enough to replace the dying red blood cells. In the US, sickle cell anemia mainly affects African Americans. Thalassemias are the inherited blood disorders where the body can't produce certain types of hemoglobin in adequate quantity, causing the body to produce less healthy red blood cells. Hereditary spherocytosis occurs when the outer covering of red blood cells, called the surface membrane, is defected. In this condition, red blood cells have an abnormally short lifespan and a ball-like or sphere shape. Hereditary elliptocytosis or oval cytosis causes a defective cell membrane in which red blood cells are abnormally oval in shape, are not as flexible as normal red blood cells, and have a shorter lifespan than healthy cells. Glucose-6-phosphate dehydrogenase deficiency occurs when the red blood cells are missing an important enzyme called G6PD. The lack of enzyme causes the red blood cells to rupture and die when they contact certain substances in the bloodstream. For the patients with G6PD deficit, severe stress, infections, certain drugs or foods can cause the destruction of red blood cells. Certain examples of such triggers include aspirin, anti-malaria drugs, sulfur drugs, non-steroidal anti-inflammatory drugs, naphthalene or fava beans. Pyruvate kinase deficiency is caused when the body is missing an enzyme called pyruvate kinase. And with this condition, the red blood cells tend to break down quickly. Acquired hemolytic anemias occur when the hemolytic anemia is acquired. In this condition, although the red blood cells may be normal, certain disease or other factors will cause the body to destroy the red blood cells in the spleen or bloodstream. With immune hemolytic anemia, the immune system destroys healthy red blood cells. The three main classifications of immune hemolytic anemia are autoimmune hemolytic anemia, which is the most common hemolytic anemia condition. For some unknown reason, this disease causes the body's own immune system to produce antibodies that start attacking our own healthy red blood cells. This disease may become severe and grow very aggressively. Alloimmune hemolytic anemia occurs when the immune system attacks transplanted tissues, a blood transfusion, or the fetus in some pregnant women. This disease can occur if the transfused blood is a different blood type than our own blood, and it can also occur during pregnancy when a woman has rhesus negative blood and her fetus has rhesus positive blood. Drug-induced hemolytic anemia occurs when a medicine triggers the immune system to attack its own red blood cells. In such case, one may be drug-induced hemolytic anemia. Chemicals in medicine, such as penicillin, can attach to the red blood cell surfaces and cause the development of antibodies. Mechanical hemolytic anemias cause physical damage to red blood cell membranes, which can cause destruction at a faster rate than normal. The damage may be caused by changes in the small blood vessels or due to the certain medical devices high blood pressure during pregnancy called preeclampsia, or a condition that causes seizures in pregnant women called eclampsia. Malignant hypertension or a rare blood disorder such as thrombotic thrombocytopenic purpura that causes blood clots to form in small blood vessels throughout the body. Moreover, participating in strenuous activities can also result in blood cell damage in the limbs at times. With paroxysmal nocturnal hemoglobinuria, the body will destroy abnormal red blood cells caused by a lack of certain proteins more rapidly than normal. Individuals with this disease are at increased risk for blood clots in the veins and low levels of white blood cells and platelets. Certain infections, substances, and chemicals can also damage red blood cells, resulting in hemolytic anemia. For instance, toxic chemicals, malaria, tick-borne diseases, or snake venom.
Now look at extract 2. Questions 37 to 42.
The samples of tissue cells can be taken from almost any part of the body, depending on the type of tumor and its location. The method of taking samples is determined. For instance, the methods followed for brain biopsies is entirely different for skin biopsies. Certain types of biopsies involve the removal of an entire organ, which are only performed by surgeons. However, other types of biopsies remove tumor samples using a thin needle or through an endoscope. In this session, I am going to explain the most common types of biopsies used in cancer diagnosis. Needle biopsy. Fine needle biopsy or fine needle aspiration and core needle biopsy or core aspiration are the two types of needle biopsies. Fine needle aspiration is performed using a thin, hollow needle affixed to a syringe to pull out small pieces of tissue and a small amount of fluid from the tumor. In case the tumor is deep inside the body and cannot be felt, then the needle can be guided while watching on an imaging tool such as an ultrasound or CT scan. The main advantages of fine needle aspiration are that there is no need to cut the skin, and in some cases the diagnosis is made on the same day. However, the disadvantage is that sometimes it becomes impossible to remove enough tissue for a detailed diagnosis. Although fine needle aspiration is a type of biopsy, it is also classified as a cytology test. However, in a core biopsy, the needles are slightly larger than those used in fine needle aspiration. In a core biopsy, a small cylinder of tissue is removed. At times, special vacuum tools are used to get larger core biopsies from breast tissue. However, diagnosing core biopsy samples take longer than fine needle aspiration biopsies. Therefore, the results also take longer. Excisional or incisional biopsy. In this type of biopsy, the surgeon cuts through the skin to remove the complete tumor, called an excisional biopsy, or a part of a large tumor called an incisional biopsy. In an endoscopic biopsy is a flexible, thin, lighted tube with a lens or a video camera affixed at the end, allowing the physician to look into the internal parts of the body. Tissue samples are also taken out through the endoscopic biopsy. Different types of endoscopes are used to look at specific parts of the body. For instance, one kind of endoscopy is used to look at the inside of the throat, sinuses, and nose. Laparoscopic, thoracoscopic, and mediastinoscopy. Although laparoscopy is much like endoscopy, it uses a laparoscope to look inside the abdomen and remove tissue samples. Similar procedures are followed to look inside the chest. These are called thoracoscopy and mediastinoscopy. Laparotomy and thoracotomy. Laparotomy is a kind of surgery where a vertical cut is made from upper to lower abdomen to remove samples. This may be performed when the suspected area could not be diagnosed with other simpler tests. There are many ways to perform a biopsy. The skin based on the type of suspected skin tumor. Shave biopsies remove the outer layers of the skin for certain basal cell or squamous cell skin cancers. However, they aren't used for the suspected melanomas of the skin. As discussed earlier, punch biopsies or excisional biopsies are used to remove deeper skin layers and are diagnosed how deeply a melanoma has gone into the skin. Sentinel lymph node mapping and biopsy helps the surgeon to know which lymph nodes to remove for biopsy. Sentinel node mapping and biopsy is a common way to diagnose whether a cancer such as melanoma or breast cancer has spread to the lymph nodes. This can detect the lymph nodes that drain lymph fluid from where the cancer originated. If the cancer has metastasized, these lymph nodes are usually the primary parts to affect.